Imagine stepping into the barn and your horse, usually so full of life, is showing these really unsettling signs, maybe staggering or twitching, just not themselves. It's a scary thought, right? And it makes you ask, what is going on? And, how do we protect them? So today, we're doing a deep dive into West Nile virus in horses. And this isn't just about a disease, it's more about this complex interplay, nature, animal health, even climate. Our mission is really to boil down the essential facts about WNV, how it spreads, how we fight it, give you the full picture without getting totally bogged down.
Yeah, and what's fascinating, or maybe critical here, is understanding it's not just the horse. The whole story involves mosquitoes and birds, too. They're central to the virus's life cycle. We'll connect those dots, look at how this global threat hits horses, and really hammer home why prevention is just paramount.
Okay, let's start right at the beginning. What exactly is West Nile virus, biologically speaking?
Okay, so WNV is a flavivirus. That's
Yeah.
a big family of viruses, often spread by insects like mosquitoes. And more specifically, it's neurotropic, which basically means it targets the nervous system.
Ah, okay. Which explains those neurological signs we sometimes see.
Exactly. That's the key.
And when did this become such a big deal globally, I mean?
Well, it was first found in Uganda way back in 1937, but the game changer was its spread, especially into the Americas, after 1999. That's when it really became this pervasive, widespread threat. We've even seen different strains or lineages pop up, like Lineage 2 in the U.S. and Lineage 1 spreading across Eurasia more recently.
And how does it actually get to a horse? What's the route?
Mosquitoes, primarily Culex species, at least here in North America, they're the main carriers. They bite infected wild birds. Birds are the main reservoirs. They keep the virus going in the environment, and then they bite a horse.
Right. Okay. So birds to mosquitoes, mosquitoes to horses, which leads to the next question. Can the horse then give it back to another mosquito or another horse?
Ah, good question. And that's a really important point. No, they generally can't. Horses, and humans too, are considered dead-end hosts.
Dead-end hosts.
Yeah. It means they get infected, sure, but the amount of virus in their blood, the viral load, it's usually too low. Too low to actually infect a mosquito that bites them. So they don't really contribute to spreading it further.
Okay, so a horse can't directly infect another horse or us. That's good to know.
Correct.
So knowing that, what does this tell us about where we find WNV and what drives its spread?
Well, its reach is huge. Global, really. Africa, Europe, the Middle East, Asia, North and South America. It's pretty much everywhere. And the climate change connection you mentioned earlier, that's not just trivia. It's a really significant driver.
How so?
Warmer temperatures, changes in rain patterns. These directly affect mosquito populations, their numbers, their lifespan, where they live. It can extend the mosquito season, push the virus into new areas. It makes predicting outbreaks and preventing them much more complex.
Right, a constantly shifting landscape. Okay, so we know what it is and how it gets around, but what actually happens if a horse gets bitten by that infected mosquito?
So the incubation period, the time from the bite to showing signs, if they show signs, is typically somewhere between 3 and 15 days. But here's the kicker, something that often surprises people. About 80%, maybe even more, of infected horses, they show no signs at all.
80%. Wow, so they just fight it off.
Yeah, their immune system handles it. They're asymptomatic. You'd likely never know they were infected.
Okay, but what about the other 20%? The ones that do get sick, what are we looking for then?
For those horses, the signs are primarily neurological. And that's critical because it hits their movement, their behavior. It can get pretty serious.
Okay, so what are those specific neurological signs? Let's break them down. You mentioned ataxia first. What does that look like?
That stumbling, staggering, basically incoordination. You often notice it most in the hind limbs. They just seem unsteady.
Okay, and then weakness and paresis.
Right, so general weakness, maybe partial paralysis. In really bad cases, they might go down and not be able to get up. That's called recumbency.
And you also mentioned muscle fasciculations, those twitches.
Yes, involuntary muscle twitching. Often around the muzzle, the eyelids, sometimes the neck or shoulder. It's a very common sign, sometimes one of the first things you see.
What else?
Well, their whole demeanor can change. An altered mental state.
How so?
It could be anything from just depression, lethargy, just not bright. Or it can swing the other way, hyperexcitability, seem really anxious, disoriented, sometimes severe unresponsiveness, like stupor.
And cranial nerve deficits, what does that involve?
That could be things like a droopy lip or ear, maybe a head tilt. Sometimes difficulty swallowing, dysphagia, or paralysis on one side of the face.
Okay. And then just general behavioral changes.
Yeah, like maybe pressing their head against a wall or walking in circles compulsively.
Are there other, maybe less specific signs people might notice?
Sure, a mild fever can happen, but honestly, it's often missed because it might be transient. Lack of appetite, liftlessness, maybe grinding their teeth or seeming like their vision is off. And in the most severe cases, sadly, it can progress to seizures, coma, and potentially death.
This sounds really serious. Does age play a role? Are some horses more susceptible?
Well, any horse can get it, any age, breed, or sex. But we do tend to see that older horses have a higher risk of developing the severe neurological form of the disease.
Okay. So with all these potential signs and the fact they overlap with so many other neurological problems, how does a vet actually know it's West Nile?
Yeah, that's the challenge. You absolutely cannot rely on just the clinical signs. They just mimic too many other
It's
things.
like, what else could it look like?
Oh, the list is long. Equine herpes virus, myeloencephalopathy, EHM, EPM, which is equine protozoal myeloencephalitis, Eastern or Western equine encephalomyelitis, EEE or WE, even rabies, which is obviously critical to rule out. And it's not just infections. It could be something like moldy corn poisoning, maybe lead poisoning, even a head injury. So you have to differentiate.
So if signs aren't enough, what's the go-to test, the most reliable one?
For a horse showing acute signs, the best test is the IgM antibody capture ELISA. We usually call it the MAC ELISA.
IgM.
Yeah, IgM antibodies. They're the ones the horse's body produces relatively quickly after an infection. They usually show up within about 6 days and can stick around for maybe up to 2 months. So a positive IgM test on blood serum or even cerebrospinal fluid strongly points towards a recent active WNV infection.
And does vaccination interfere with that test?
That's a great point.
Yeah.
Generally, no. The WNV vaccines we use don't typically cause a significant IgM response. So the MAC ELISA is still really useful, even in horses that have been vaccinated.
Okay, that's helpful. Are there other diagnostic tools vets might use?
Sure. PCR testing can look for the virus's actual genetic material. You can run that on, say, brain or spinal cord tissue if available, or CSF, sometimes even blood, although the virus level in blood is often pretty low in horses. Virus isolation, trying to grow the virus, that's usually done post-mortem from tissue samples. And if you're unsure about a horse's vaccination history, you might take paired blood samples a few weeks apart and look for a significant rise in the IgG antibody levels. Ig is the longer-term antibody, right? And then there are general lab tests. CBC, a complete blood count, might show changes like low lymphocytes, which is common with viruses. Analyzing the cerebrospinal fluid, the CSF, might show increased white blood cells, particularly mononuclear cells. These are all pieces of the book.
So let's say the diagnosis is confirmed, West Nile virus.
Yeah.
What happens then? What are the treatment options?
Well, this is the tough part. There's no specific antiviral drug that cures WNV in horses.
No cure. So what can you do?
Exactly. Since we can't attack the virus directly, the focus is entirely on supportive care.
Supportive care. What does that actually involve day to day?
It's all about managing the symptoms, keeping the horse comfortable, and supporting their body systems, while their own immune system fights the infection. So, anti-inflammatory medications are really common. NSAIDs like flunixin-banamine or phenylbutazone, Bute. They help reduce inflammation in the nervous system and control fever.
What about steroids?
Corticosteroids are sometimes used, but their effectiveness is kind of debated, and there can be side effects. And something like diazepam, Valium, isn't recommended. Certain sedatives, alpha-2 agonists, might help with the muscle twitching and anxiety, though.
Okay. What else?
Fluid therapy is often critical. Intravenous IV fluids help keep them hydrated, especially if they're not eating or drinking well, or if they have trouble swallowing. It provides electrolytes and some nutrition, too.
And if they go down? If they become recumbent?
That's a really serious situation. Sling support might be necessary. Using a sling helps prevent pressure sores, muscle damage, and even pneumonia, which can happen if they're down for too long.
That sounds intensive.
It is. And then there's just general good supportive care, keeping them in a safe, quiet, well-bedded stall, turning them if they're down. Diligent nursing care makes a huge difference.
So with all that effort, what's the likely outcome? What's the prognosis?
It's variable, unfortunately. Overall, about 30 to 40% of horses that show neurological signs may die or need to be euthanized because the disease is too severe.
That's pretty high.
It is. However, there's a flip side. For horses that manage to stay standing throughout the illness, the survival rate is much better, maybe 80 to 90%.
Okay, that's more hopeful. But what about after they recover? Are there lingering effects?
Yes, that's definitely a possibility. Even among the survivors, maybe up to 40% can have long-term neurological problems.
For how long?
It could be 6 months, sometimes longer. Things like weakness, incoordination, or behavioral changes might persist. This can obviously affect their ability to be ridden or just their overall quality of life.
And being recumbent, going down, is that a bad sign?
Yes, being unable to stand is considered a grave prognostic indicator. The chances of recovery drop significantly if they become recumbent.
Yeah.
But here's where prevention comes back in, and it's fascinating. Vaccination seems to really make a difference. Vaccinated horses that do still get sick tend to have much milder signs and a significantly lower risk of dying.
Okay, that really underscores the importance of prevention. So if treatment is tough and the outcome can be serious, how do we prevent WNV? It sounds like that's where we need to focus.
Absolutely.
Yeah.
The consensus in the veterinary world is clear. Prevention is by far the most effective strategy, and it's a two-pronged approach.
Two prongs.
Yep, vaccination and mosquito control. You need both.
All right, let's start with vaccination. How important is the West Nile vaccine considered?
It's considered a core vaccine. That's the designation from the American Association of Equine Practitioners, the AAEP,
Core vaccine, meaning?
meaning they recommend it for all horses, pretty much everywhere, regardless of their specific location or job. It's considered essential basic protection like tetanus or rabies vaccines.
That's a strong recommendation. So what does the schedule look like for vaccinating a horse?
Typically for a horse that hasn't been vaccinated before, the initial series is 2 doses, given about 3 to 4 weeks apart. After that, they need boosters. Usually it's annual, but in areas with a high risk or a very long mosquito season, vets might recommend boosting every 6 months.
What about foals?
Foals born to mares that were vaccinated get some initial protection from the mare's colostrum. They usually start their own vaccine series around 3 months old. If the mare wasn't vaccinated, the foal might need to start earlier and get more doses initially, maybe something like shots at 1, 2, 3, and 6 months old. Your vet will recommend the best protocol.
And just to be clear, the vaccine prevents infection completely.
Not necessarily 100% immunity. Think of it more like significantly reducing the risk and the severity. As we said, vaccinated horses, if they do get exposed and infected, generally get much milder symptoms and have a much better chance of a full recovery.
Okay, so vaccination is crucial. What's the second prong? Mosquito control.
Exactly. Vaccination helps protect the horse internally, but mosquito control aims to reduce the chance of them getting bitten by an infected mosquito in the first place.
Makes sense.
Yeah.
So what practical things can horse owners actually do?
The biggest thing is eliminating breeding sites. Mosquitoes need stagnant water to lay their eggs.
So dump out standing water.
Yes. Regularly empty and clean things like water buckets, feed tubs, old tires, bird baths, even unused troughs, at least once a week.
What about things you can't easily empty, like ponds?
Right. And check rain gutters that get clogged and hold water. That's a prime spot.
Good point. Gutters. What else?
Manage the environment. If possible, stall horses during the times mosquitoes are most active. That's usually dawn and dusk. Using large fans in stalls can help too. The airflow makes it harder for mosquitoes to fly and land.
Fans, okay. Screens.
Screening out barn windows and doors can definitely help keep them out. And maybe avoid leaving bright lights on inside stables at night, as that can attract them.
What about repellents?
Yes, use equine-specific insect repellents. Follow the labels carefully. Fly sheets and fly masks also provide a good physical barrier against bites.
Any other measures?
In areas with unavoidable standing water, like drainage ditches, you could talk to local mosquito control authorities about using larvicides products that kill mosquito larvae.
And one more thing. If you find dead birds on your property, handle them safely, don't touch with bare hands, and report them to your local health department. Sometimes dead birds can be an early warning sign of WNV activity in the area.
Okay, that's a lot of practical advice.
Yeah.
So bringing it all together, what's the current picture? Is West Nile still a major threat we need to be actively managing?
Oh, absolutely. It hasn't gone away. West Nile virus is still a constant public health and veterinary concern. You look at surveillance data, say, from places like California, they report horse cases every single year. It just confirms it's an ongoing presence and endemic disease in many areas. Vigilance is still key. So looking forward then, what does this ongoing presence plus things like climate change mean for the future? For managing WNV in horses and maybe even humans?
Well, research is still digging deep into the immune response in horses, especially vaccinated ones. How exactly does the vaccine protect them? And what's really critical there is that understanding the horse immune response could directly help develop better, or even the first licensed W&V vaccines for people. We still don't have one for humans, despite ongoing cases.
Interesting. So research in horses benefits human health, too.
Definitely. And that climate change factor we talked about, that's a huge emerging concern. Warmer weather, weird precipitation patterns. It's likely extending mosquito seasons, pushing mosquitoes and the virus into new areas. So the risk landscape for both horses and humans could keep changing, potentially increasing. It makes long-term management a really dynamic challenge.
Wow. We've really covered a lot today, taking this deep dive into West Nile virus in horses, from, how it spreads globally, the whole dead-end host thing, right through to why vaccination and just being relentless about mosquito control are so vital. And understanding all these pieces, it's not just about keeping our horses safe, is it? It really highlights how connected everything is: animals, environment, us.
Yeah, I think the clearest message that comes through is that knowledge really is power here. Knowing the risks, knowing the signs, and especially knowing the preventive steps you can take. The information we've unpacked today gives horse owners practical tools, but it's also, I think, fascinating for anyone interested in these diseases that jump between animals and people, zoonotic diseases.
Absolutely. So, as we wrap up, here's something for you, our listeners, to think about. Given how adaptable West Nile virus seems to be, and with climate change throwing curveballs, what kind of unexpected challenges might pop up down the road in managing diseases like this? And maybe more importantly, how can we keep using what we learn from animal health research, like with WNV in horses, to better protect human health too? Something to ponder.